Today I would like to talk to you about autism spectrum disorder, or autism. Autism is a developmental disorder that presents with behavioral, intellectual, and social deficits. As the name implies, an individual with autism falls on the spectrum, which means that the severity of the deficits really depends on the severity of the disorder. So, other than caring for other human beings and wanting their quality of life to be improved, why should you really care about autism? Well, a big reason is cost. So, an individual with autism that has an intellectual disability or intellectual deficits, the lifetime cost for that individual is $2.4 million. An individual with ASD that does not have an intellectual disability, the cost is still $1.4 million. So as a taxpayer, you really should care because all the money you're paying in taxes is probably funding some of these programs and teachers and whatnot for these individuals with autism. So in order to really grasp what autism is, I think it's important to know the criteria that's stated by the Diagnostic and Statistic Manual of Mental Disorders in the 5th edition, which is the latest edition. So some of these criteria include deficits in nonverbal behavior such as eye contact, facial expression, and body language, and stereotyped or repetitive speech, motor movements, or use of objects. It's also important to point out that these symptoms must limit and impair functioning because a lot of these symptoms might just be, a child just being a child. So it is important that they actually limit and impair functioning in the actual child. The Center for Disease Control and Prevention has actually stated that autism is the fastest growing developmental disability in the US, affecting 1 in every 68 children. Boys are more likely to be affected by this, with prevalence rates of 1 in 42 compared to girls, which are affected 1 in every 189. So boys are actually 5 times more likely to develop autism than girls are. I think there's multiple factors that have been producing these increases, like, for instance, the stigma of mental health over the years. So in the 90s and earlier, people with mental health were almost outcasted and shunned from their communities, so people didn't seek out treatment as much, especially if you're a parent of a child with autism, you're not going to be as likely to seek help for your child, whereas now mental health still isn't where it should be, but people are more open and willing to talk about mental health, so parents could be possibly taking their children in to the doctor, which is leading in increased diagnosis compared to the past. I think the role of doctors is also a huge factor to consider when considering these prevalence rates. So in the 90s and 80s and earlier on, psychiatry and psychology, even today, are still relatively new disciplines in medicine and science. So there was not a lot to really go off of, and there's always been a shortage of psychiatrists in our country, even today, which means that people with loved ones with autism spectrum disorder more than likely didn't end up going to a psychiatrist because of the shortage and because of the stigma. So they more than likely ended up going to a general doctor who really didn't specialize in psychiatry, which could lead to the underdiagnosing, if you will, of ASD, whereas today psychiatrists are better equipped to actually pick it out and be able to diagnose it, which could obviously have led to these increases, primarily because of the fact that we are better at diagnosing, we are better at recognizing it, and we have a better set of criteria than we did before. So, a possible cause that people have been debating about has been our food and how there's more hormones being placed into it more than ever, and how they're modified to last longer. Our environment is another potential cause that has been leading to these increase due to the rise in pollution and other environmental factors that potentially could be setting off some genetic factors within us. What we do know is a big contributor to autism are genetics. So this includes things like Fragile X syndrome and increased protein synthesis and hereditary factors. So the hereditary factor in autism is a strong one. Say has actually cited that if a one identical twin has autism, then the other twin has a 90% chance of also acquiring autism. Say has also linked a gene on the X chromosome to autism. So a woman has two X chromosomes. So if the woman carries this gene on the X chromosome that passes it to her son who has an X and a Y chromosome, especially the deleted version of this particular gene, then her son will develop autism. So that's also an indication of why boys are 5 times more likely to get autism, because a woman always carries the healthy version of that gene on her other X chromosome, so meaning her daughter will also have a healthy version of that X chromosome, even if her mother passes her down the deleted version of the X chromosome, whereas the boy only has one X, which is passed down from his mother, so he doesn't have a backup like the girl does. According to McCary and Roberts, Fragile X syndrome is the leading genetic cause of autism, representing 5% of all cases, with as many as 50% of these individuals with Fragile X syndrome meeting criteria for autism. Yates has also cited several studies done on mice involving a link between an increase in protein synthesis with autism, and how an increased translation initiation factor, which is a specific gene, has resulted in autism-like behaviors in mice. There have been significant pharmaceutical efforts in an attempt to help those with known genetic factors that have contributed to autism, for example, Fragile X syndrome. So McKay and Roberts performed a 10-week open trial of acamprosate, which actually resulted in substantial improvement in social behavior and a reduction in inattention and hyperactivity for 75% of the participants. So there are treatment options available to those with autism. For instance, behavioral treatment such as the common and popular ABA treatment, which is a behavioral treatment that focuses on increasing social and behavioral skills. Although it only works in a small portion of those individuals with autism, there have been noted cases where gluten-free diet has actually been shown to improve deficits in an individual with autism. So it's also really important to go over some of the few common misconceptions people have about autism and how it develops. So a lot of parents are actually afraid of vaccinating their child because of fear that their child will develop autism, and this isn't true, because the general thought of this fear was that the levels of mercury would actually contribute to the development of autism in their child, which isn't true, because the levels are and were so minimal that they would really do no harm to the development of the child. So another common misconception that people have regarding autism is that people who are autistic are, for a better word, retarded, which to begin with isn't politically correct, and the new term is intellectually disabled. But people really do think this, because it is common for an individual with autism to score below 70 on a standardized intelligent test, which could lead to the misconception of people thinking that individuals that are autistic are actually intellectually disabled, which again isn't the case, because there is a clear difference between being autistic and being intellectually disabled. Primarily that autism develops after birth, and a person who's intellectually disabled, that happens prior to birth. So the big thing I really want someone to take away from this presentation is to hopefully be better able to understand autism and the history of it and the criteria and the misconceptions and the causes. So knowing all this and being equipped with this knowledge is really crucial to raising awareness and early detection of autism, which can really lead to a great enhancement of individuals' quality of life. Because the earlier autism symptoms are detected, the sooner that individual can get treatment and options can be explored, so they have more time to help develop more properly. So raising awareness, just like anything with anything else, either mental disorder or any other illness like breast cancer, for example, awareness is always the first line of defense against a disease or disorder in this case. What I would really like to see, and I'm sure millions of other people would also like to see, is some sort of early detection that can clearly help define whether a child is either developing autism or at risk for developing autism. Like this slide, for example, shows the difference between the overall brain size, because children that are autistic actually do have a physically larger brain than individuals that do not. So implementing some sort of early detection, either with MRIs or some sort of screening process, I think would be really beneficial to improving the quality of life for those with autism.